Thank you very much, Presiding Officer. And let me start by drawing members' attention to my membership of the Institute of Advanced Motorists, an organisation that is interested in training drivers for safety. We now have the ability to change the legal alcohol limit of drivers in Scotland. We can all clearly identify that drink driving is an obvious hazard. When you combine that with our rather unpredictable weather and dark roads during Scotland's winters, we have a toxic mix that we need to tack tent of. Less alcohol in the bloodstream of fewer drivers equals fewer accidents and fewer deaths. So changing the legal blood alcohol content levels from 80 milligrams to 50 milligrams per 100 millilitres of blood delivers much at little cost and with no real inconvenience. And it's a positive change which I and many others, clearly from the debate, have supported for a long time. Countless stories can be told of loss, pain, death, injury, resulting from the reduced coordination, slowed motor skills, blurred vision, poor judgment, and impairing effects of alcohol upon drivers. We have the opportunity for Scotland here to take the lead, just as the Labour-led administration, to their eternal credit, did with smoking. BMA tells us that driving becomes considerably more risky once the alcohol level rises above 50 milligrams per 100 milligrams of blood. Despite a 10 times greater risk compared to sobriety, we currently let drivers at 80 milligrams into cars to drive legally on our streets. So what would a reduction really mean? Dramatically reduces the crash risk at 50 milligrams to 1/5 of the level at 80 milligrams. Still double that of a non-drinking driver, but an enormous advance over the current arrangement. Risk rises steeply with increase in alcohol in the bloodstream. The rest of Europe has done it. A good percentage of the rest of the world. It's time we did it. A report provided by the International Centre for Alcohol Policies demonstrates that Austria, Denmark, the United States and Sweden showed a decrease in the number of, quote, reported drink-drive trips and injurious or fatal accidents after the levels were lowered. We know that it works. Lewis MacDonald had a little bit to say about devolution, and that's not the core of the debate. Let's do what we've got. I do think, however, it might be useful if devolution handed whole policy areas over. I'm in favour, as we know, of 100% devolution of everything, but that's not today's debate. I think it would be simpler for the administrations both sides of the border, frankly, if we conducted things that way. Richard Simpson, an ever-thoughtful contribution on matters of health, talked about France. I've just come back from France. There was a bit of confusion. I actually thought I needed the breathalyzers in the hire car that I had and was a bit disconcerted to find they weren't there. I'm glad to find I was driving legally rather than in terror. I'm also pleased to hear that Dennis Robertson doesn't drive, although I have twice participated in Grampian Society for the Blind's Driving Day, where blind people and blindfolded members of the Scottish Parliament drive round a racetrack against a timed trial. So interesting to think about that.
Dennis Robertson.
If the member's going to promise he'll be seen driving sometime soon, yes, of course.
I thank Mr Stevenson for taking an intervention. Can I say that all the driving instructors at the Appard Transport Museum, when taking their blind or blindfolded members around the car, have not been drinking?
Stewart Stevenson.
Can I say many of the blind drivers have displayed far greater skills than drivers with sight, but with lots of alcohol in their system. We had a historical lesson from Richard Lyle. My father, as many GPs, used to test in the 1950s people who were brought in as potential drunks to see if they could walk along a white line. Thank goodness, and Richard Simpson clearly remembers that as well, thank goodness we've now moved to a more scientific basis of testing, one that's much more objective. But as we change the limit, as change we must, we have to have a programme of education and information that really gets home to the difficult-to-reach groups that are actually our driving recidivists, and I use that term advisedly. We have to be in a position where nobody can, in practice, say, I didn't ken. It's never an excuse in law, but it's got to not be an excuse that people can deploy in practice. The International Centre for Alcohol Policies again states heightened public awareness of drink driving issues largely responsible for decreases in drink driving infractions following the lowering of limits. And that's an important point that we need to take account of. I caution Alec Johnson, who I think is getting very confused about statistics. Of course, the risk of people 3-4 times above the limit is dramatically higher, probably 50 times higher than sobriety. But that doesn't alter the fact that most people who are over the limit are near the limit and in numerical terms are responsible for most of the accidents that we seek to advise. The world has changed. When my father was a GP in the 1950s, he could actually prescribe alcohol to his anaemic patients. Stout, we used to get samples of Sweetheart Stout and Guinness sitting in the surgery waiting to go out. Let me just close, Presiding Officer, by making a few more comments about aviation. It's worth saying, by the way, our breathalyzers in Scotland are already calibrated to test at the 20 milligram level. That comes from questions I asked of the previous executive in session 2. There is an additional requirement placed on pilots beyond the 20 milligrams. They are forbidden to drink for 8 hours before they fly. So there are further things we can think about in the future. I pose the question, if you want your pilots to be at that kind of standard for safety, why would you get into a car where somebody is operating to lower level? Lower levels, systematic breath testing, that's what we need to save lives and ensure safe travel. I'm very happy to support the Government's motion today.